Hi everyone, my name is Jacqueline Kerler and I am a rising junior at Bucknell University, and today I will be presenting on ciprofloxacin and how it accelerates gastrointestinal transit in a rodent model of fluoroquinolone-associated disability. Fluoroquinolones, or FQs, are a widely used antibiotic that is meant to be prescribed for life-threatening infections. Due to many noted side effects, such as neurological disorders, hepatotoxicity, tendinitis, and even anxiety and depression, the FDA issued a warning to be cautious in prescribing this drug. They have also grouped these symptoms under what is called fluoroquinolone-associated disability, or FQAD. Despite this warning, clinicians still continue to prescribe this drug and even administer it for conditions that it is not meant to be used for. Previous studies have suggested that FQs may be a selective inhibitor of GABA-A receptors, which means that the main inhibitory neurotransmitter, GABA, would not be able to bind in the central nervous system. Since GABA is crucial in regulating the vagus nerve, and the vagus nerve is a key regulator of digestion, any change in GABA could lead to gastrointestinal issues. With this in mind, GI issues have been reported by patients that have taken fluoroquinolones. We aim to test the hypothesis that ciprofloxacin, the most commonly prescribed FQ, is altering GABA and the vagus nerve, thus inducing problems with motility. Our goal was to study these reported GI issues and determine if they are a consequence of FQs by analyzing weight change, food intake, and digestive patterns. Sprague Dolly rats were treated daily for 14 days via oral gavage with either 20 milligrams per kilogram of body weight of ciprofloxacin, which was the experimental group, or 0.3 milliliters of 0.9% saline, which was the control group. To monitor weight change and satiety, the rats and their food were weighed daily. To determine any changes in digestion, the rats were fasted for 24 hours after being treated for 2 weeks and given a 1.5 milliliter oral gavage of 0.5 milligrams per kilogram of phenol red dye. 20 minutes after it was administered, the rats were sacrificed and parts of the stomach, proximal, middle, and distal small intestine were harvested and homogenized. The amount of red dye present in each part was measured via spectrophotometry. After obtaining the data from these experiments, it was determined that there was no significant change in weight and food intake across the two groups. However, there was significantly less dye recovered from the stomach, proximal, and middle small intestine in rats treated with ciprofloxacin. Furthermore, these results were more prevalent in female rats. This data suggests that administering 20 milligrams per kilogram of ciprofloxacin in rats does model what is seen in previously obtained human data of FQ administration, as human data demonstrated that ciprofloxacin altered motility and that females were disproportionately more affected by it than males. This conclusion strongly suggests that gastrointestinal disorders should be included as a severe side effect of fluoroquinolones, and that clinicians need to be more aware of and cautious when choosing to prescribe this drug.